Good morning everyone. So now welcome again to our question discussion. We are at the end of our question discussion of this bacteriology. We have discussed many questions and last two more questions are remaining. So let's complete it and then we'll begin another chapter with the revision and with the knowledge, and then we'll get to the practice question. Okay, so let's move forward. We have a patient who is admitted to the hospital because of the bleeding duodenal ulcer. There is culture is 37 degrees. Culture at 37 degrees Celsius reveals a urea is positive, gram negative, cough rot. Which of the following likely complication due to the infection with the causative agent? So we need to actually go through point by point. So let us discuss, let us think about it. We don't have much time while dealing with the USMLE question. We usually get 1 to 2 minutes. So in that scenario, you have to understand what is your diagnosis, and then at last they will not ask about the diagnosis. They will have a different questions. So you have to pick that as well. So the scenario, tell you the diagnosis, reach to the organism, and then finally the last question which will ask you something else that is related to that organism obviously, but not will be directly, they will not ask directly the organism. They may ask you the primary or secondary or tertiary level of question. So that is very important while dealing this USMLE question. So first let's diagnose. As the case, a patient is admitted to the hospital because of the bleeding duodenal ulcer. So there is a peptic ulcer disease. You have to understand that. So currently the peptic ulcer disease is caused by the organism. They are saying that they are the urease positive, gram negative, cough rods. So you already know the peptic ulcer disease or duodenal ulcer is caused by the H. pylori, which is a world potential carcinogen that can lead into the stomach cancer or carcinoma in long run. So we understand this is the only the organism that can survive in our stomach. This is microaerophilic. They can survive because they produce this urease enzyme. That urease will produce, that break down the urea and produce the ammonium environment around surrounding it. So there is a continuous maintenance of this alkaline environment around the bacteria due to the high production of the urease. And since there is a continuous alkaline environment, the highly acidic pH, that is 1.5 to 2 pH that is in your stomach, will not kill those H. pylori organism. So only the organism that can survive in your stomach is H. pylori. All other organisms can be killed in that pH. Only the H. pylori will survive. So they are saying you have a duodenal bleeding ulcer, and they are also giving you the point that urease positive, gram negative, cough rods, which are the feature of H. pylori. So your diagnosis has reached to the H. pylori. Now let's see what the question they are going to ask. They are asking which of the following is likely complication due to infection with this causing agent. So after infection with the H. pylori, what is the complication? Is there a diarrhea? No. Is there a kidney stone? No. Is there a pseudomembranous colitis? No. Is there vomiting? No. What is the long-term complication? The complication is stomach cancer. So you have to understand what is the scenario. The information will narrow down to the organism, and then they will ask, on the basis of that or diagnosis, that organism, they will ask you another question related to that, and we need to answer that. Okay, let's move to the last question, and then we'll done with this. So now then we will have a microbial, genetic and drug resistant cases, which we will discuss in after studying. Let's first finish our last question. So there is a question where we have a roommates of 19-year-old college student become alarmed when he does not get up, go to the swim practice in the morning, and they are unable to wake up for his 11 a.m. He had complained of headache and not feeling well night before. So there is a guy, room partner, who is seeing his friend is sleeping, he's not getting up. Usually they used to go to the swimming classes in the morning, but he is not waking up till 11 a.m. And before going to the sleep, they were talking, and the guy who was sick has told he is having headache, bad headache, as well not feeling well in the night. And then he went to sleep, but in the morning he is unable to wake. The rescue squad has arrived. They find the patient is, the boy is febrile, comatose young man with a petechial rash. Now they are giving you some of the hint. So there is a petechial rash as well as febrile, fever is there, rash is there, and coma. So patient is comatose. So three findings there. So you understand there is some infection that has led to the fever, as well as that has led to this neurological involvement. In the emergency room, Corning and Brzezinski sign are present. So your meningitis feature, that is Corning sign and Brzezinski sign, both are positive. No papilledema is seen. So spinal tap is done. Now we have gone for the CSF study. So a guy who is a 19 years old roommate has been have a bad headache and not feeling well before night, now not able to wake up in the morning, and found comatose with febrile and petechial rash all over the body. When examination we found physical examination, the Skirning sign and bruising signs are positive, so neurological involvement, that meningitis feature has been demonstrated. Now to identify what will be the cause of this meningitis, they have done the CSF study, they have done the spinal tap, they have drawn the spinal fluid and see what is the condition. So on spinal tap, after report has came, they found the protein is high, glucose is low, and WC count is 9000. So there is high neutrophil, glucose low, and protein high. This is the characteristic finding of your bacterial meningitis. So there is protein high due to the this glucose will be utilized by the bacteria, protein content will be high due to inflammation, and WC obviously will be high in the bacterial infection. So with few RBC, the characteristics most likely causative agent. Now we have to identify this is that 19-year-old boy with bacterial meningitis, and the most common organism that cause bacterial meningitis in this age group is Neisseria meningitidis. What are the bacteria in newborn? There is the Streptococcus agalacti, then E. coli, Listeria, and then other Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitis. When we goes to the adult and adolescent, Neisseria meningitis come first, then Streptococcus pneumoniae, Haemophilus influenzae, and elderly again they will be this Neisseria meningitis, Streptococcus pneumoniae, E. coli, then Listeria monocyte. These are the organisms that are responsible for the meningitis. So in this age group, the most common organism is Neisseria meningitidis. What is Neisseria meningitis? It is a gram-negative diplococci that can ferment glucose as well as maltose, that is capsulated organism. So we have to find out this feature is given in your option or not. This is an enveloped DNA virus. This is not a viral, this is a bacterial infection. Naked iron virus, again this is not a viral infection. Gram-negative bacilli, this is not due to the gram-negative bacilli, it is not due to, it can be due to E. coli or cell Listeria, but since we are thinking about in this age group, the most common cause is Neisseria meningitis, so we need to find out the gram-positive cocci, that is a diplococci, that is important. So gram-negative or diplococci. So gram-negative oxidase-positive diplococcus, and this is your answer. So you need to understand what you are going to find and what is your answer. A gram-positive, Lancet said alpha hemolytic. No, we are not talking about this Streptococcus pneumoniae. We are talking about the gram-negative oxidase-positive diplococcus, and also there is this petechial rash. This rash is also present in the Neisseria meningitidis infection. So this meningitis with petechial rash, fever, and bacterial presentation leads to the bacterial meningitis with rash, and that is due to this Neisseria meningitidis, which is a gram-negative diplococci that is oxidase positive, and that ferment M for M, maltose. Gonorrhea ferment glucose only, where meningitis ferments both maltose and glucose as well. So we have done with the bacteriological question. I hope you have gain some of your revise your knowledge which you have revised in the USMLE step 1 to microbiology, and also point out reach to the diagnosis. You have able to understand how to analyze the question and how to reach the diagnosis and how to answer the question, and in this way you will be able to diagnose all your scenario and then answer all your questions. All the best everybody. Thank you.